Welcome back, our fans. Definition: dental implant is defined as a prosthetic device of alloplastic material, implanted into the oral tissues, beneath the mucosal and/or periosteal layer and/or within the bone, to provide retention and support for a fixed or removable prosthesis. Benefits of dental implants. 1. Offers several benefits over conventional tooth replacement options. 2. It prevents bone loss because the implant anchors the jawbone and thus prevents further bone loss. 3. It restores the function and aesthetics of the overall maxillofacial prosthesis. 4. It offers best and most preferred option for stabilizing loose dentures. 5. It is thought to be the only option to deliver the fixed prosthesis where the conventional bridge is not possible. 6. It is the strongest and long-lasting treatment for the replacement of missing teeth. 7. The deep flanges and palatal extension of complete dentures, which cause substantial discomfort to patients, can be avoided once the denture is retained over the implants. Implant prosthetic options. 1. Single tooth replacement. 2. Partially edentulous patient. Implant prosthetic options. 1. Completely edentulous patient. A. Fixed porcelain metal restoration. B. Fixed hybrid restoration. C. All implant supported overdenture. D. Implant and tissue supported overdenture. Dental implant is a prosthetic discipline with a surgical component. History of dental implants. Subperiosteal implants. Swedish practitioner Gustav Dahl, who placed his first subperiosteal implant in 1940. It is a metal framework constructed of different materials, e.g. vitalium, aluminum oxide, carbon or titanium coating, shaped to ride on the residual bony ridge beneath the periosteum. Transosteal implants. Mandibular staples. Transosteal dental implant is a dental implant that penetrates both cortical plates and passes through the full thickness of the alveolar bone. Endosteal dental implants. A-blade implants. The endosteal blade implant was introduced in 1967 by Leonard Linko. The implant type has the form of a flat-shaped blade, metal plate, so it can be placed and be completely in contact with the bone on both sides. Professor Per Ingvar Brandmark. Father of modern dental implantology. Vital microscopy of bone marrow in rabbit. Titanium chamber for long-term vital microscopy study of bone and marrow tissues circulation in situ, 1952. After 6 weeks fusion to bone occurred. 1960 announced 10 years dental implant integration in dogs. Implant clinical studies in humans started and 10 years follow-up success was reported in 1977. The anchorage capacity of integrated fixtures was illustrated by suspending the dog via wires connected to separate fixtures. In 1982, Brandmark presented his scientific data at the Toronto Conference on osseointegration in clinical dentistry, which proved to be the turning point for the treatment's acceptance. In the same year, the U.S. Food and Drug Administration, FDA, approved the use of titanium dental implants in the United States. Osseointegration. It is a histologic term describing the direct connection between living bone and the surface of a load-carrying endosseous implant at the light microscopic level. 4 factors to achieve osseointegration. 1. A biocompatible material, titanium. 2. An implant precisely adapted to the prepared bony site, precision instrumentation and sound surgical procedure. 3. A traumatic surgery to minimize tissue damage. Sharp, high-quality drills, low speed, high torque. Copious irrigation 47C. 4. An immobile, undisturbed healing phase. Primary and secondary implant stability. The stability that the implant achieves immediately after insertion is completely mechanical and is called primary stability of the implant. During the healing period, however, the biological processes of osteointegration change this to a mixture of mechanical and biological stability, secondary stability. Dental implant materials. Titanium. Titanium and titanium alloys were introduced to implant dentistry for the first time in the 1960s. They have also proven their worth as a material of choice for the prosthetic superstructure since the late 80s. Forms of T. 1. Commercially pure titanium, CPT, titanium grades from 1. Highest purity, low oxygen and iron, -4 highest oxygen and iron. CPT grade 1, highest corrosion resistance and lowest strength. Nobel Biocare, Sweden, made of CPT grade 1. 2. Titanium aluminum vanadium alloy, T6Al 4 volts, grades from 5 to 29. Higher strength. Titanium has certain specific properties which makes it absolutely ideal for these applications. 1. Mechanical strength. 2. Corrosion resistance. 3. Biocompatibility, surrounding tissue remains vital and shows no toxic symptoms or encapsulation of the foreign body. The soft tissue also establishes close contact with the titanium. 4. Modulus of elasticity. Dental implant design. Types of implant. Body. Straight or tapered. Threaded or non-threaded. 1 stage or 2 stages. 1 piece or 2 pieces. Roughening of implants by titanium. Plasma spraying. The titanium plasma sprayed TPS surface was the first rough titanium surface introduced into implant dentistry. The titanium plasma sprayed TPS surface process is characterized by high velocity molten drops of metal being sprayed onto the implant body to a thickness of 10 to 40 micrometer. TPS implants demonstrated satisfying long-term results in fully and partially edentulous patients. Ha-coated surface. In order to enhance the bone connection to the implant, a thin coating of hydroxylapatite Ha has been plasma sprayed onto a roughened and prepared titanium implant. Subtractive methods. Roughened titanium surfaces can also be produced by reduction techniques such as sand or grit blasting, acid etching, combinations. The original surgical protocol by Brandmark. Original protocol demanded that 1. After extraction of teeth, the edentulous site had to heal for a period of 6 to 8 months. 2. The implant is inserted below the crestal bone. 3. Obtaining and maintaining a soft tissue covering over the implant for 3 to 6 months. 4. Second stage surgery to uncover the implant and placing the abutment. Evolution of implant placement protocol. The first dental implant protocol presented by Brandmark included extraction of the offending tooth, followed by a period of wound healing and bone formation, 8 to 16 weeks. But once a tooth is extracted, the remodeling of the alveolar bone and the gingival tissues could compromise an ideal implant location. Immediate implant placement. The concept of immediate implant placement began to emerge more than 40 years ago by Schulte in 1976. Due to the desire to increase the overall efficiency of the process. Advantages of immediate implants. Reductions of surgical interventions. Shorter treatment time. Ideal implant positioning. Preservation of alveolar bone at the site of the tooth. Extraction. Better soft tissue aesthetics. Thanks for watching. Support us by likes and subscribes.